Good day to everyone. The previous discussion or tutorial that we had the other time was on surgery and surgical nursing. That is unit 2 for those that have got the course outline for surgery and surgical nursing. That is general nursing curriculum. So we looked at, we actually introduced orthopedics, which is unit 2, like I've stated already. We looked at, or we introduced certain terminologies that are used in orthopedics and orthopedic nursing. We also looked at the principles that are supposed to be considered in orthopedic nursing. We further introduced the topic. Therefore, today we'll go a little bit down. So those 3 parts, they fall under unit 2. There was 2.1 where there's introduction of orthopedics and orthopedic nursing. Then there was 2.2 where you find the principles that are involved in the management of orthopedic patients in nursing. Then 2.3, it involves the common terminologies that are used in orthopedic nursing. Therefore, we can move a little bit to 2.6, where you find some abnormalities that are actually affecting the bones and the joints. So let's look at, number 1, let's look at scoliosis as one of the abnormalities that actually affects the bones. What is this scoliosis? Now, before we go into details, I would say you need to have some objectives. So the general objective states that at the end of this discussion, students should be able to acquire knowledge and how to manage scoliosis. The specific objectives states that at the end of this lesson, the student should be able to define scoliosis. Number 2 objective under the specifics states that students should be able to state the signs and symptoms of scoliosis. Number 3 or third objective states that students should be able to manage scoliosis. When we talk about management, we're referring to investigations. We are also referring to the medical treatment. And in this case, since this is surgery, some surgical interventions that can be done. And eventually, a student nurse should be able to apply the specific nursing care to the patient with scoliosis. So, having stated our objectives, what is scoliosis? So scoliosis is a medical condition in which a person's spine has a sideways cave. Usually this condition is characterized by uneven shoulders and back pain. What we mean by uneven shoulders is that under normal circumstances, each person, when they stand in an anatomical position, their shoulders appear to be at the same level to each other. But in the case where one has scoliosis, then the shoulders don't look to be at the same level. One will look a bit lower than the other. Why? Because of the either S or C-shaped spine that a client has. So where the cave goes further, that shoulder will be affected. Hence, it will be a bit lower. So the cave is usually S or C-shaped, by the way, meaning that when you look at this client posteriorly, you'd notice maybe somewhere by the thoracic spine, there will be a C structure. The spine will appear like a C, the letter C, or sometimes it may even appear like the letter S. So in some, the degree of curve is stable, meaning that it does not give them much problems. While in others, it increases over time, especially those that are involved in heavy lifting. Then the S or C-shaped spine keeps worsening because of the load. So mild scoliosis does not typically cause problems, like I've stated, but severe cases can interfere with breathing. That's why some of them you might even find them with breathing difficulties. Otherwise, in mild cases, there is no pain present. Now, you can see that there is a picture there showing scoliosis. That spine does not look normal, of course, but I'm sure you're able to appreciate the cervical vertebrae. You're also able to appreciate the thoracic vertebrae. You're also able to appreciate the lumbar vertebrae, the sacrum, and the coccyx. But you can actually tell that from somewhere lumbar 5 going upwards, the spine is not as it is supposed to be. It is caved. Now you can even see that the shoulders are not even because of caving of the spine. You can even see the position of the ribs. That some ribs, they appear to be a little bit superior to the others that are on the other side. So that is the case of scoliosis. Now, what causes scoliosis? So the actual cause of scoliosis is not known, although it appears to involve hereditary factors, because the disorder tends to run in families. Less common types of scoliosis may be caused by the following factors, however. So despite scoliosis being able to run in families, neuromuscular conditions such as cerebral palsy or muscular dystrophy may also lead to scoliosis. Birth defects also affect the development of the bones of the spine. There could be also birth defects that you have seen before, like those that affect the palatine, the cleft palates. Even on the spine, birth defects may be there. And in this case, birth defects may bring about someone developing scoliosis. Injuries or infections of the spine may also lead to scoliosis. Now, having mentioned the causes of scoliosis, how would someone present? How does someone who has scoliosis present themselves? So symptoms associated with scoliosis can include pain in the back, especially if they involve themselves in heavy lifting. They can have pain in the back. They can have pain in the neck, the buttocks. They can have constipation due to the curvature causing tightening of the stomach or the intestines. These people experience limited mobility, usually which is caused by the pain they're feeling. It becomes really difficult for them to have the normal gait or normal movement. They can also experience some functional limitations. For an adult who does some work somewhere, they tend to have some limitations because of the pain they are feeling. If it's a female, they may also experience pain of menstruation. And even musculature on one side of the spine may be present. If you looked at the other picture that I showed you that is showing scoliosis, you'd actually notice that The other side, the ribs have gone a little bit lower, while the other side, they've gone a little bit upper. It provides, this condition brings about uneven musculature. Rib prominences may be present, or a prominent shoulder blade, which is caused by rotation of the rib cage in the thoracic scoliosis. When the scoliosis is affecting the thoracic region on the spine, then you have rib prominences. There can be uneven hips, meaning the hips are not at the same level. One hip will appear to be a little bit pulled upwards, while the other one will appear to be a little bit lowerly positioned. Or sometimes you might actually think that the other limb, it is actually the other limb, meaning the lower limbs, the other limb might appear to be longer than the other, and yet it is just scoliosis presenting itself like that. Some patients might experience slow nerve action. Having discussed the signs and symptoms that a patient with scoliosis may present, how now do you diagnose this condition? So first of all, remember the way we attend to these patients. They would appear at the outpatient department where you get the history, inquire from them. Remember the causes, at least the patient will be able to give you one cause as you get the history from them. Remember, the history might be objective or might be subjective. So history will review possibly any of those causes. Maybe someone had trauma, was involved in an accident, or they had some infection of the spine previously. Or sometimes history may review that this scoliosis actually is there in their family. Physical examination, specifically on inspection, you notice that this person has uneven shoulders or uneven hips. Or sometimes if you view them posteriorly, you notice that someone's spine is appearing C or S shaped. You can go further, do an X-ray of the spine, which will review an abnormally sideways curved spine. You can go further and do a computed tomograph, which is a CT scan, which will also review an abnormally sideways curved spine. You may so wish to go further and do the magnetic resonance imaging, abbreviated as MRI, of the spine as well. We'll also review an abnormally sideways curved spine. Having looked at the investigations, at least you'll be able to come up with a diagnosis to say, this is actually scoliosis, which is an orthopedic condition affecting the spine. Now, how do you actually treat this condition? So the traditional medical management of scoliosis is complex and is determined by the severity of the curvature and the skeletal maturity, which together help predict the likelihood of progression. Like I mentioned to you, sometimes someone can have mild scoliosis, the other person can have severe scoliosis. However, the conventional options for children and adolescents are as follows. In children and adolescents, you can start by observing this patient, because we hope that as they grow, maybe there can be an improvement, depending with the cause. However, if there is no improvement noticed, then you can start bringing in the issue of the brace. You apply the brace that will run from the cervical region to somewhere down to the pelvis that will try to immobilize this spine. So the brace of choice may be the Muloti type. If you have gone through the types of the braces, then you understand that the Muloti type of brace would be the best for us. If all this doesn't work, observation and brace, then bring about surgery of the spine. So what should be done? If one or two vertebrae, adjacent vertebrae, are a bit mobile or they are mobile, you have to get them fixed surgically or fused surgically so that there is no further mobility in between the two or more adjacent vertebrae. So the surgical fusion of two or more adjacent vertebrae is what we're going to call spinal fusion, which is actually the surgical intervention that can be done in scoliosis. For pain management in an adult, you can use analgesics like brufen. Usually the usual dose for adults, it must be calculated very well. But on average, adults will use 400 milligrams TDS at least for 3 days. That will help relieve the pain. Brufen will also help relieve the inflammation if at all it's present. For adults, however, treatment usually focuses on relieving of pain. So you give analgesics, like I've stated already, brufen can come in, diclofenac can come in. The brace is also another intervention that can be done in adults, the same Mulocki brace. If these two don't work in adults, you can as well go and look at the surgery, which is the same spinal fusion, of which spinal fusion, one can use either the anterior approach in surgery or the posterior approach. So that picture in that slide is showing a woman with scoliosis. As you can see, the first, if you're able to follow my cursor, the first picture there, it doesn't have any piece of cloth for you to see the protrusion of the shoulder blade, and also the inferior angle of the scapula of the right scapula is actually protruding there. Then you can see the inferior angle of the left scapula, it's a bit flat. If you follow the reddish line downwards, you'd actually tell that this woman has scoliosis. The second picture is showing a woman with scoliosis, but with a brace trying to immobilize the spine. The other picture there is just showing an X-ray that was done with someone who has scoliosis and is clearly showing the S-shaped spine. Okay, if you have any questions pertaining to scoliosis, you can always forward them to my YouTube channel where you can find them, or any comments, I can actually find them there. Then I can respond to one or two. But if you're among my students in my class, then you'll be able to interact with me on our interactive Zoom classes that we usually have. Thank you so much for your listening. Hope to be chatting with you frequently, just like this. Once more, enjoy your day. Thank you so much.